Rewarding careers, experiences of a lifetime. Explore travel PT at aureusmedical.com. AUREUSmedical.com.
NPTE StudyCast.
Welcome to NPTE StudyCast. I'm your host, physical therapist Jimmy McKay. On the program this afternoon is Bree Mercer. Bree, welcome to the show.
Thanks, Jimmy. I'm excited to be here.
Bree just finished a neuro residency at the Cincinnati VA and now working inpatient rehab in Fargo, North Dakota. We appreciate your time, and we're talking about what pathology today with students to help them on the NPTE.
We're talking about Alzheimer's disease today.
Yeah. Neurodegenerative disease that comes up quite often on the test. Let's go into describing the pathology briefly.
Alzheimer's disease is really the most common cause of dementia in older adults. It's irreversible and progressive in the brain. It's going to affect memory, abstract thinking, judgment and problem solving, language, and personality. It's most common in people over 65, but it can occur earlier, and then it would just be considered early onset Alzheimer's.
Yeah, whenever you hear something like that, a pathology being most common and having so many different things that it can affect, gives it a lot of opportunity to show up on the NPTE.
Absolutely.
All right, so let's get into what's involved with Alzheimer's disease.
So it's thought to start in the hippocampus, the main part of the brain used for memory. But as it progresses, it's going to have effects that are widespread in all parts of the brain. There's three main factors that are thought to be involved, looking at the development of beta amyloid plaques, neurofibrillary tau tangles, and then losses of connections between neurons, so losing those synapses. For us as physical therapists, one important thing to be aware of is that low physical activity and then factors associated with cardiovascular disease, so uncontrolled diabetes and hypertension, are also thought to be risk factors for the development of Alzheimer's.
How is this ruled in, ruled out, proving it or disproving it?
So with this diagnosis, it's going to be made by a physician, and it's generally going to be based on ruling out all other possible causes of dementia. You can really only prove it on autopsy, but a physician can also do a CT or MRI of the brain to see the brain atrophy. That's also going to be associated with Alzheimer's.
Differential diagnosis.
All right, so differential diagnosis, we know that it's really a pathology of ruling out, but other things can be similar or show up on a test question to look close to Alzheimer's. What's a differential diagnosis for this?
So looking at other things, you can have other non-Alzheimer's dementias. So dementias associated with Parkinson's disease, Huntington's disease, multiple sclerosis, a brain tumor that's affecting cognition in those areas associated with Alzheimer's, normal pressure hydrocephalus, and then also thinking about delirium or reversible dementias.
Treatment examples.
Now, we mentioned it is progressive and irreversible, but physical therapists do work with individuals along their course in Alzheimer's disease. Some treatment examples. If you're working with an individual living with Alzheimer's disease, what are some things that come to mind?
So some things that I might do with a patient with Alzheimer's disease, giving them exercise interventions to make sure that they can maintain their ability to perform their ADLs as long as possible, increase their overall activity. Like I said before, those factors associated with cardiovascular disease are thought to be a risk factor. Improving or maintaining their function if they've lost some function, whether it's related to their Alzheimer's or not. Thinking about balance training to decrease their fall risk. We don't want to have them have a fall and then be worse off. Caregiver education is also going to be really important with these patients as they're more progressive in the later stages, making sure they're using appropriate cues with the patient to help keep them involved, giving them good safety measures in the home, guarding them with different exercises and activities, and then giving them recommendations for home setup and modifications there.
Here's your example question.
Everybody's favorite part of the show is the sample question. Give us something that we can wrap our heads around and how this might show up on the NPTE.
You're evaluating a patient in the early stages of Alzheimer's disease. What are the most important factors to address with this patient?
All right, so most important factors. That's the thing to key on with a question like this. And what are the choices, Bree?
A, home exercise program to maintain activity and fitness. B, balance training to reduce fall risk. C, caregiver education on positioning to prevent pressure sores. Or D, both A and B. So with that question, I'm looking at early stages of Alzheimer's disease, and then, like you said, most important factors. So D is the correct answer for me. So they're still in the early stages. They still can be active and participate. So you're going to really focus on home exercise program and balance training with this patient.
Bree Mercer, appreciate your time taking a look at Alzheimer's disease and how it might show up on the NPTE.
Thanks again. It was fun.
Download free study guides now at aureusmedical.com/NPTE StudyCast. aureusmedical.com/NPTE StudyCast. Rewarding careers, experiences of a lifetime. Explore travel PT at aureusmedical.com.
NPTE StudyCast. Brewed by the PT Pintcast.